versus taking an LLM and training that on your data? Has someone that's done that? Because I know that.
Okay, that's what we did. There was no LLM, right? When we built our first model, there was no LLM.
So
And we built our own version of an LLM, right? And it was, we called it a narrative cloud, right? Now, yes, so we did that before. Now, the thing is, you have to be smart about these things because it doesn't make sense to try to train new models when there's a whole open source community that's constantly pumping out good models. Meta produces these Llama models that operate to some extent GPT levels, right? Like GPT-4o could compare with Llama 3.1, the new one, right? And depending on the model. So I think that area, I don't want to commoditize, but people have to start getting aware of, that this is, you can't just say that ChatGPT is the best model. You almost have to make the choice between what's the right model for the right problem, and then kind of go at it that way.
Can you go back to the question?
Yeah.
Yes.
So you had a question about, how do you apply these in your clinical practice aspect of it. I think the hard thing that I'm seeing is how do you differentiate between what I call ChatGPT wrappers versus real product. There's so much noise here that people come in out of the woodwork like, I built a model overnight in my basement and now here's a product you can go buy. And that's the hard part. I think time will help flush all these out. There's a lot of this noise right now. If you go to any of the incubators, I see like, hundreds of these kids coming up with these, we build these models and blah, blah, and all they're doing is passing, some kind of wrapper around OpenAI's product or some other, even their Llama models, and not really thinking through and evaluating and testing it around that. I don't have a good answer, like how to, especially for small practice, how you actually go find those things, but that's some of the things.
But I think
You
important.
can collaborate with someone.
Yeah,
You have any recommendations?
Yeah, definitely. I mean, we will collaborate with you if you want me. We can talk, right?
Definitely.
Because we like to work with both hospital and small practices. But I think, Khan, I like every time I talk to doctors, there are like, we come with new use cases right now, right? And there's endless volume of use cases that exist in AI. I think the question that I am focused on in my business, right, is to find use cases that you can find budgets for and that people are willing to pay for, right? And I think that's what people have to focus on, right? So I think use cases, yesterday I had a talk with some ER guys and they came up with 4 use cases. And the day before I had a talk with a pulmonologist friend, and he came up with another 3, and I just pushed all of them. I'm like, guys, find me the buyer and let's go talk to the buyer, right? Let's figure out that this is a real problem and this is not just a nice to have where we, because the tech is there. These are not technology challenges anymore. The billing problem, right? For example, revenue cycle management. That is not a technology challenge. Anybody here, like think about it. What do people do? Coders do? They take a note and they write these CPD and ICD-10 codes about it. Why shouldn't that be automated through AI? It's a very simple use case. But why is it happening? Because someone feels threatened because they're going to lose their jobs, and some buyer does not have a budget for it yet, right? So if we can focus on if there's a revenue stream and there's a willingness to pay, start from that, and then the use cases, build the use case after that. I always feel that way.
There could be a very specific sort of practice that I want to have only females, only for Muslim females, only in only in one state. So
Yeah.
that's how I want to start, and then maybe like a quicker kind of thing, and then go into other states. So Muslim females and in a few cities of Illinois.
Yeah, I mean, I'll just give you an example, right? Like one of the things we do is, so the UChicago chatbot that's going live, people ask a question, find me a doctor who has star rating above this, lives in this area, has treated these kinds of diseases, right? And is female, right? And so then it goes, right? And it automates the process. And now think about how hard it is to schedule an appointment. You're stuck on a phone for a long time, no matter what the hospital system, and now all that process is made much faster through this. So I think there are use cases we can talk about, right? I mean, but I think I would just urge everybody that the use case applies endless, and because the technology can do so many things, right? It's about finding the buyer, finding the opportunity, make sure that whatever you're doing, there's somebody who has a pain that they're really willing to pay for before
Is
you do it.
HIPAA compliant?
Yeah,
That's the first thing.
yeah, yeah.
That's table stakes, right? You can't be healthcare printing software if you're not.
Yes,
Go.
Afroz.
Yeah, no, I was just gonna pivot off of that. You know, there's a company called, rather a product called Nuance, ambient listening, and they're scratching the experimentation of RevCycle and how they could take that note-taking, drop it into Epic, translate it with the drop codes based on the notes, and then end user being the physician as well. So it's just interesting how that's coming full circle, and hopefully the cost reduces in the long term as well, but I just wanted to mention that based on that.
Thank you. We're like scratching the surface on a really rich conversation, and I think many people have like specific questions for our panelists too. But I want to be mindful of time. I would like to just end the panel's portion of this event with just 2 questions for our panelists, and then we'd love to just like ask people to come up with more questions, or we could just bring for our networking event, and then people can chat individually. Okay, so my 2 questions are: what has surprised you the most from your time you started working in the AI space till today? And then what do you see as the greatest need or the greatest opportunity for those of us who are getting into this space or we're now in it, as it relates to like taking AI to the next level, crossing the chasm, as you said?
Yeah, I think, so I'll start this one because I was not a healthcare person, right? I mean, okay, I'll start with that. And I've spent like the last 8 years really diving deep into this because I personally felt that of all the industries that I saw, the most valuable data set was sitting in healthcare, and that's where I thought solutions needed to be built, right? So I think that's kind of what drove me to this. So what I've seen about AI in general is that while it is a very important problem to solve, and it is the largest industry, right? $4 trillion industry, larger economy than several countries, right? It probably ranked like 4th or 5th, right? If you just looked at the US healthcare economy itself. While the opportunity is there, it's not a free economy. It does not work like other industries. There are regulatory restrictions and organizations like these EHR that restrict innovation. So for example, if you go in and you say, look, I have this amazing solution that's going to do this, chances are you have to get blessed by Epic, right? And you literally have to go and partner with them in a way and share a significant portion of your revenue with them before you really can make it in. And so these are the things that I've learned, right? So personally, is to find what I would call white spaces that Epic is not in, to go in there. And because I don't believe in that, why should I have to go partner with Epic, right? Why can't I go around or do things that they're not involved in? So that's kind of my learning lesson there, right, is to be careful. And then the other thing is, while I love the healthcare solutions because I think they're impactful, and it's not just about making money, it's about solving a real problem that the world needs. It's hard, right? These are very slow sales cycles. They take forever to close. Getting inside a hospital system or healthcare institution is one of the hardest sales cycles, right? How do you permeate it? So I think that's the other aspect, and so therefore, we, having been in healthcare, and even in radiology, we're sort of broadening out to say, okay, we're going to be more broader and be more open to other industries, which may also perhaps be easier to penetrate and not have this Epic issue, right? Where it's not just, I say it's not just the chasm, there's an epic chasm, right? Where Epic is kind of restricting you from crossing that chasm, right? And so how do you kind of go through that? So those are kind of my plans.
So for me, the surprise is like, I started working on this in 2003, 2004, and when I joined Microsoft in 2008, I thought by 2012, 2015, this would be all done, right? We would be fully implemented. I'm very optimistic if you think of it that way, right? Because these are real problems. you know, it's impacting patients, and why not, address this, and why would should the system, so as Farooq said, you know, really surprised how it took long. I think what happened was, when the initial AI models started doing better than humans on image detection, everybody assumed that's the same thing. And image detection, what they were doing, they were looking for cats and dogs and fire hydrants and cars on pictures, right? Everybody thought that's the same thing as what radiologist does. And Jeffrey Hinton famously, in his, you know, when ImageNet competition they won, AlexNet won, said they don't need to train radiologists anymore. And he said for 5 years, there's no radiologists. And that context started the fear mongering, right? If he had said this is going to help radiology be accurate, there would have been, everybody would have jumped on it, right? But because that's how the statement was phrased by him, it went into the fear mode versus going to the optimistic mode to do the stuff. Detecting disease, radiologists have been doing it since in the 90s. Computer detection for breast cancer came out late 90s. And, you know, I don't know, any of the radiologists in somewhere in the room can talk about, we've had lung cancer detection and breast cancer detection programs, and they get reimbursed since I was in my residency in 1999, 2000, right? So that's not new. So suddenly, because of this narrative that started, it created this weird, you know, fear in this stuff, and there was stagnated the adoption of the stuff. The other thing is sometimes technology needs to come into place too, right? So in 2012, there were 6,900 radiology practices. So if you had to go build a product, you had to go sell to 6,900. Today they have 300. Because of PE acquisitions that have happened, now the decision makers are fewer. So the whole buying aspect has changed, as Farooq was saying. Now, the very large groups that can make decision, and suddenly you are everywhere deployed. So trying to sell something in 2012 was really, really hard. It's getting easier because of consolidation that is happening because of the market. You know, a lot of the IT laws have changed, standards have improved, data sharing is getting better, that is changing, all of that aspect of it. So a lot of these things come into play are making the shift right now, and obviously AI becoming mainstream because of OpenAI has also changed the mindset. Now people are using AI at home to do other things, you know, and that just becomes the norm and changes the